Hi, I'm Dan, and I'm here today with pharmacist Virginia, who's a information content creator. Today, we're going to ask them how they create trusted, evidence-based health information. You'll also learn about what they do and why they do it, and maybe you guys can do it yourselves. So let's get started. Thank you, Virginia, for being here today. Our first question is, what kind of health information do you create?
Thank you, Dan, for inviting me today. It's a real privilege to be here. In terms of the type of content that I create, I am a UK registered pharmacist and a medical copywriter. So, I create videos mainly for YouTube and Instagram, and I also create carousels and images and posters, leaflets, website pages and blogs, FAQ pages, which are answering frequently asked questions, and other social media posts about medicines and health tech or digital health, and also health conditions. I have my own channel called Pharmacist Virginia, and I create videos for the NHS and also for the WHO, which is the World Health Organization. And I specialize in persuasive writing that is straight to the point, but it's also accessible. So I write at a low reading grade so that people who may have English as a second language or may not have high levels of health literacy and find health information really difficult to understand, so they can understand it too. And I also have a background in design accessibility and web accessibility as well, in terms of how images and font and colors are used and how they're laid out on a web page as well. So the format, and also even how you hyperlink things, which are called anchor text. So I really have kind of developed my skills over the past 3 years, creating content for the internet, but making sure it's as accessible as possible because it's health information.
Excellent, lovely, thank you very much. So, why did you decide to create health information?
So that's a great question. And it's one of my favorite questions because I think a lot of people always think about, what is my why? Why do I do this? And one of the biggest reasons for me is that there's a lot of misinformation on the internet, but there's also a lot of information, which is great, but it's not accessible. So you've kind of got two things going on at the moment. And one of the small kind of impacts that I had recently was I spent a lot of time creating videos on clove oil, which you can buy for a couple of pounds from the pharmacy, and then also magnesium sulfate paste. And these are, non-branded things, so they don't get a lot of marketing, if you like. And there was a lot of misinformation on YouTube in particular. So I decided to create some videos, and they now rank number one on YouTube, even against other channels which have hundreds of thousands of subscribers. But if you actually go and watch those videos, they give a lot of misinformation. So I felt like I had quite a good impact, and those videos continue to get thousands of views, even though I don't have thousands of subscribers. So 99% of people that watch my videos are not subscribed. So I don't think that, the number of followers or subscribers you have doesn't necessarily reflect the quality of the information that you are receiving. And I think it's really important for people to keep that in mind. And I think it's amazing that I can create information from home and reach all of these people around the world, and help support them with the health information that they're looking for, in an accessible way. And as a medical writer, with my knowledge and background of search engine optimization, which is SEO, I'm able to find and fill those content gaps. So I'm able to update or refresh any old information or any misinformation that I found, which I did recently with the clove oil and magnesium sulfate videos. And I hope to keep doing that. And then, as an individual content creator that essentially does everything by myself, so from the research to the script writing to the recording to the editing, the publishing, and all of the SEO and kind of tagging to make sure that people can actually find my video, because one of the creation standards is to make sure that you have as wide a reach as possible. So I really put in all of the kind of behind the scenes work with all of the amount of writing you have to do, even for video content, is quite a lot. And it's worth it because you actually reach the people which is that you want to reach, which is evident from the videos I created recently. And so as an individual creator, it's hard work, but then also I can create shorter videos quite quickly if there's something like what's happening right now. There's a measles outbreak, or lots of people have coughs and colds. And it's also an opportunity to collaborate with charities and also signpost to charities that produce good health information that has been PIF TICK approved or follows similar standards, because I know there's the NHS standard, there's the Academy of Medical Royal Colleges standard, and both of those standards are pretty much based on the PIF TICK standards. And even the WHO, the World Health Organization, has acknowledged PIF as probably the only organization in the world that has these information standards. So it's great to have the opportunity to raise awareness, especially as I ran a travel health clinic when I was working in London as a pharmacist. And a lot of people don't know about the risks of travel and that you need vaccines to go to certain countries, that you shouldn't pet dogs because there's a risk of rabies, especially stray dogs.
Yeah.
And these are life-threatening illnesses. And I think there's not much campaigning, and it's also about, campaigning about things which are close to heart that I've experienced in my real life in the pharmacy, and giving people that kind of aha moment that, they didn't know something and they're now going to go home and act on that information to improve their quality of life or feel a bit safer on holiday. And so I love to simplify complex information. And I think in pharmacy especially, there are lots of technical terms and difficult to pronounce medicine names. So you can kind of feel more familiar with a medicine if you watch someone on video and you can replay that video to understand it better, because I definitely think video as a medium with someone speaking to you and pronouncing the words is quite powerful compared to trying to read the words on your own. And it's a privilege to share the knowledge I have from my pharmacy degree and from my practice as a pharmacist, and I just love it. I think it's great. I love being creative as well, and it's great to have an impact, again, like beyond the pharmacy and beyond just one person. You can impact many people and all over the world, because I think access to health information is difficult, and this is my way of kind of having an impact to make it a bit easier.
Excellent. Thank you for that. It's clear that you are passionate about what you're doing. And I think one of the big things that just came out from that answer was about that collaboration and the mis and disinformation. I don't think one individual or one organization can combat mis and disinformation. So it's really good that, having something like the PIF TICK and being part of that, you can all help signpost to each other. You understand what each other are doing. It's all good quality. So it's great for you to kind of highlight that.